lot of the patients come with their question in their mind, will I be fit for surgery? And with experience of what we used to do before I went into UK and US, always we used to get a no for patients who had these comorbidities. But now, thankfully, the scenario has changed. I mean, I would say thanks to you guys who have made a big difference, because I never had a no from you whenever I asked for a patient who needs a surgery. So, what do you think has changed in the recent times?
I believe mainly when we are starting our management of the patients and planning them for the procedures from the preoperative area, that will bring a huge impact on the recovery and ultimate outcome of the patient in terms of safety, reducing complications and everything. So when you send us the patients, and it all depends whether the case is, since it's orthopedic surgery, you will come across 50% of your patients also in terms of like an emergency in the timing also. But when we have like time to optimize the patients, like at least a minimum of 2 to 6 weeks, which is the optimal period that we feel like. So we do work what is called a new regimen, which we start from the pre-op area. So which stands for a nutritional health, mental health, and also physical health. So this is something that we do on a routine basis for every patient, because it's not a one size fit all approach. It's a multimodal approach which we do, and a multidisciplinary approach which we tailor it to every patient individually, depending on how they come up with. So when we do have time for the elective procedures like knee replacements, for fractures and everything, mostly sometimes you won't have much of time in our hands, and we do the best that we can. But for elective patients who are coming in for surgery and we do have time, so this is the approach that we usually, expose them to the new regimen, which stands for nutritional, endurance, and also work. That means that we send them for nutritionist and also put them on high protein, and also for exercises, which we called an high intentional training programs that we expose them to, and also the physical health. Mm-hmm. So when we expose them to behavioral cognitive therapies, so it helps them to anticipate and also prepare them mentally. It's mostly when they don't know what to anticipate, the anxiety, and it also builds the resilience when we expose them to this regimen. So that helps them a lot. And also, for example, sleeping, we do the screening for all the sleeping disorders. Mm-hmm. So which will help them to diagnose with sleep apnea. And if at all they already have sleep apnea, we put them for CPAP and all these regimens. So these simple things which we used to feel doesn't add much to the value, but nowadays what's happening is it decreases the inflammation, it decreases the complications, it mentally also prepares them for the procedures, so and also helps with the recovery.